Virus special, We Together. Thanks for joining us. I'm Kelly Saberi. Tonight, we have 3 local leaders who have all been working tirelessly through the pandemic in different areas on the show with us to answer your questions. First things first, everyone is spaced 6 feet apart from one another. We have Tracy O'Rourke, the Chief Administrative Officer at Stormont Vail with us, along with Carol Perry, who is the Chief Nursing Officer at Stormont Vail as well. And with the Kansas Chamber, Alan Cobb is with us too. Thank you all for being here tonight. But before we get to the questions, let's update you on the latest numbers we're seeing in Kansas right now. At this moment, more than 176,000 people in Kansas have tested positive since the pandemic started. More than 1,800 people in the state have died from the virus. And right now, more than 1,100 people are in the hospital fighting the virus in Kansas. Looking at the headlines right now, Walmart and Sam's Club announced they will be selling a series of at-home COVID-19 test kits, online. They will cost anywhere from $99 to $135. And the Better Business Bureau is warning you of pet scams right now. This year, they've seen an enormous spike in scams for buying a pet, and they believe it's because people are just more lonely right now in the pandemic. Plus, an expert at Johns Hopkins University says anyone who has already tested positive for COVID-19 should still get vaccinated when it's ready. This is because it's not clear how long someone is immune for after being infected. And the eyes of the world are all on the UK as people there are set to receive the first doses of a new coronavirus vaccine. A batch of vaccines arrived at a South London hospital this weekend. This comes just days after the UK authorized Pfizer and BioNTech's shot for emergency use. Around 800,000 doses of the vaccine were expected to be in place for the start of their immunization program tomorrow. The vaccine won't just be provided by hospitals, though. Local doctors' offices and other local healthcare centers are being put on standby to start delivering the vaccine. So the vaccine is what's on everyone's mind. So let's start with our hospital representatives. Let's talk about the anticipation and importance of getting this vaccine in. Ms. O'Rourke, we'll start with you.
Sure. Yes, we're highly optimistic, and it's great news to see that the vaccine is coming to Kansas. We're continuing to learn about both vaccinations and when they will be here, how they will be administered, and what we can do to help be a part of that process. We are encouraged by the trials and the outcomes. We have an entire team who's been devoted to keeping themselves informed and understanding better the vaccination, how it will be administered, what is the immunity, and how that will affect our community. But it's so important that we are considering this as part of the solution to the pandemic. And through having the vaccination available first to our healthcare workers and those who are most vulnerable, and then over time to the public, it'll be a great step towards getting immunity within our communities here.
And Ms. Perry, what do you think as somebody with your background?
I think from a nursing perspective or a healthcare perspective, there's going to be a lot of questions, and what we can do to have pamphlets and information so people really have as much information that we have to share with them so that they can make a decision on getting the vaccination with confidence that this is what it's going to take to become a healthier community and be able to move forward so that we can all get out of this situation and become a healthier community. So I think that I want to be able to get that to the healthcare providers. They'll be one of the first that will get it, and then the vulnerable population, and it'll be kind of scary for some. So we want people to be as confident as possible and get it, and I'm going to encourage all my loved ones to get it, and I'll be taking it myself when it's my turn.
And just one more question about the vaccine. Can you talk about any of the planning you're doing ahead of the vaccine getting to the hospital?
Sure. You know, we've stayed close to the information that's been out there through KDHE. They had asked us for information early on, and like many providers, we are anxiously awaiting to hear next steps. And as I said before, we have a team that has been involved in studying what is happening through the trials and through the different development of the vaccination. So as Carol said, we're prepared to educate our team members, our community, and be prepared for whatever comes next as we learn more across these next few days as to when something's going to be available to us.
And Ms. O'Rourke, is there a plan for the hospital right now about how quickly you can get it out to your employees?
You know, we are just waiting to hear back from KDHE as to what the plan's going to be. As I said, if we're asked to help, we are going to be there to help. That's what we've been doing all along.
Now, Ms. Perry, how are your nurses doing 9 months into this? We've talked to you specifically when this all started about how they were doing, and they were coming up with ways to keep hospital morale up. Can you tell us about that?
Yeah, I smile because I tell people I really looked young before this all started. But from my perspective, I think that staff are so good to each other and they lift each other up. And I watch them work, and I've never been prouder of a group of people when they care so much about the patients. And you know, a lot has changed in the way that they deliver care and the way they batch care and the way they go in the rooms and the way they communicate with families. And so they've really had to relearn and then stick to the basics and then relearn the new environment and how they can best deliver the care and protect themselves and protect the patient. And so how to keep morale up. Every day we talk about that. We make a lot of rounds. We ask them how we can help them. And most recently, we've really become more focused in on ways that different people can express themselves and talk about what their inner pain is. I mean, clinicians and providers really, they learn to step back and focus on the patient, and they don't always let their own emotions out or their own feelings out. And so there's some things that Stormont's doing to really try to help them help themselves so that they have more energy and have just more strength as they see a lot of things that are very sad and that they haven't seen in the past.
Now, that being said, is there anything that people can do to celebrate and support our nurses through such a hard time?
Oh, yes, they can, and they have. I can tell you, we live in a community that daily we get calls and prayers and thoughts and gifts and that lifts up the staff so much because they know what they're doing day in and day out. It really does matter, and especially when somebody tells a story about their loved one and how they felt and how they appreciated all the providers, not just nurses, but everyone taking care of them. It means the world. And at Stormont we do what's called small moments, and we start and tell a story about if somebody sends in a story about how we took care of their family, and we share that across the system. And I think that is wonderful, because there's nothing like having a family member that may not have had a positive outcome tell you that you couldn't have shown more compassion and kindness and love, so the community gives to us all the time, and we want to give back to them, and we want to be open and accept every patient that needs to come to us. So thank you.
Well, Ms. O'Rourke, this next question is a good one, because we know throughout the pandemic people have been putting off going to the hospital for other emergencies and treatments not related to coronavirus. So Sandra Powell has a question. She says, I'm scheduled to have a hip replacement surgery on January 13th, and quite frankly, I am concerned about the possibility of contracting COVID. Knowing that this is an elective surgery, I am 72 years old and have chronic bronchitis. Can you provide insight into this?
Sure, it's a great question, and that's one of the things that we want to encourage the community to consider is don't put off your health care services. That's why we put into place the things that we're doing to protect not only our patients but also our team members. And so, you know, the hospitals are one of the safest places you can be. We're using the appropriate protective equipment. We are cleaning. We are doing all the things that we need to do to stay protected and to protect our patients. And when we talk about elective procedures, when somebody's in pain and when they're hurting, we know that that also impacts their overall health, and we want them to receive the services that they need in order for them to have a better quality life. We don't want people to put off routine health care like your mammogram, your colonoscopy, the things that we do in order for us to detect and to be able to care for patients should they have other conditions. We are using telemedicine, and almost 30% now of our visits are through telemedicine. Of course, we can't do hip replacements through telemedicine, but the other things that you can be doing to see your physician, to see your provider, and make sure you're staying healthy. Those are the things that we want to be able to continue to provide. New patients, we have access for new patients. We have access for our current patients. And so those are important things to consider. And if you have questions, talk to your physician, talk to their office, and they will walk you through exactly how the procedure will be done, what you can expect in the prior to that procedure, during the procedure, and then your recovery.
Very good information for us all. Thank you both. Now we're going to take a short break here, but don't go anywhere because our coronavirus conversation continues. We're going to chat with Alan Cobb next with the Kansas Chamber and answer some more of your questions right after this.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
We want to make your holiday season bright. Go to KSNT.com and enter for your chance to win one of 12 gifts during the 12 Days of Giving sweepstakes. Sponsored by Brookwood Shopping Center. Happy holidays.
The KSNT News Sky Tracker, sponsored by MT Helicopter Solutions.
Let's hear it for Bob's Burgers. Jane Sunday on Fox.
Welcome back to our special conversation about where the coronavirus pandemic is at right now and how it's affecting our area. Let's switch gears for this segment and talk about the impact COVID is making on people's jobs and careers. So to do that, let's bring in Alan Cobb with the Kansas Chamber. Thanks for joining us here tonight.
My pleasure to be here, and thank you for KSNT and for Stormont Vail for sponsoring this. It's a great conversation.
Now, it's easy to say the pandemic has taken its toll on the economy, and in turn, many businesses are struggling. So how are the businesses in the state impacted right now?
Well, it depends on the business and the sector. Obviously, hospitality, restaurants, hotels, entertainment have been much more impacted. There's some businesses that have seen some growth, so it does depend on the business, but there are some businesses that we've had record business closings in Kansas, but we've also had some record business openings, so it's provided some opportunities for some entrepreneurs. But restaurants, hospitalities, these are folks that are struggling, and I encourage everybody to visit their local retailers and local restaurants.
Now, you did mention entrepreneurs starting new businesses. To you, does it seem like a good idea to do that, or does it seem risky, or are you even excited for them?
Well, entrepreneurs are full of risk, so it depends on what their risk appetite is, but there certainly is always opportunities in any part of the market and the economy. So I don't know that I could give some advice, but there's obviously things that are changing in the marketplace. They always do change, and I think some folks are seeing some of those changes in how consumers consume products and buy products, and they're providing those products and services to them.
Now, when we talked to you in April during one of our town hall discussions, you said at some point, possibly soon, the health crisis will subside to the point where business and society can begin to reopen. To ensure Kansas is ready, state and local government officials and business leaders should work together to develop specific health metrics and safety criteria that, when met, will give businesses, their employees, and citizens confidence in the safety of their workplace so we can begin to reopen the economy. How are those conversations going? You know, at that point in April, things were starting to look up again, and now it feels like we're in a rough space again with the rising cases.
Those are ongoing conversations. I mean, April seems like 2 years ago, and so we're still having those conversations with healthcare folks like Carol and Tracy about how do we do this in the best way, and how do we reopen, or keep open, I should say, not reopen, but keep open, and how do we stay safe and keep the economy rolling. These are going to be ongoing conversations. We have to be honest and open and have real data and real conversations about how to do this in the best way and keep the public safe, but also keep the economy rolling. These are not easy conversations. There's no easy answers. There is no silver bullet, or we would have found it. We're Kansans, we would have found that answer, and it's not exactly there, but we're still having those conversations.
Now let's talk about how the relief and recovery agenda is going and how that reflects related to the health and economic data. Before the pandemic, a lot of people may not have realized how hand in hand business and health are. How has that group and agenda helped keep things going?
I think it's helped the Kansas economy. We've actually, every state in the country is suffering a little bit. We've suffered less, I think, because we've taken better precautions and been smarter about it. It's partly our industry mix, but it's not about essential businesses, but about safe businesses. I think businesses are interested in keeping their customers, vendors, and employees safe. It's just smart business, and most, if not, I can't say all, but almost all have done that. So I think most have followed the CDC guidelines and other KDHE guidelines because they want to stay open and provide services to their customers.
How is the Chamber's initiative Vision 2025 going? The goal is to get Kansas to grow quicker, and as part of the mission, it says we need to remove the barriers and to grow and seize the enormous opportunities before us to grow our economy, strengthen economic prospects, and secure the future for all Kansans. Has the pandemic created a slowdown for that goal for growing local business?
Well, the economy has slowed down because of the pandemic, but in some ways there are a few silver linings in the pandemic that the governor and some of the legislature suspended some regulations, and that created difficulties for businesses to open or provide products or services. Those have been suspended in March and April. The world has not ended. I think we've seen that we can reduce some of the government intervention in business. They can provide products and services to the public, and so in some ways this has shown us a little bit of a light that yes, we can do better with a little bit more free market principles and less government intervention. So but the economy has definitely slowed down, of course, but it's slowed down in Kansas less than other places.
Now, right on that note, we've seen across our area and the country that restrictions are getting tight again. In California, the governor is telling people to stay home altogether. In Minnesota, restaurants are completely closed again for in-person dining. Can you talk about what restrictions you think will be the most talked about again that might need to be loosened or eliminated as we keep pushing forward in this pandemic?
I think some of those, but I will give Kansans credit. There has not been a lot of serious conversations about shutdowns, and I think we're very data oriented, and I would challenge the governors of Minnesota and California to look at, does the data support shutting down outdoor dining or even indoor dining? And I don't think there's a lot of data to support that. I think there's other things that have caused the spread, and then of course there's a lot of unknowns about the spread, and I understand government officials wanting to do something, trying to solve the problem, and I applaud them for that, but I will give Kansas public officials of both parties and local and state government some credit for being somewhat restrained on doing some of those things. We supported some things in March and April that we would not support now as we've gotten more information and data about how it spreads, and also the impact of shutdowns on mental health and economic health and health, that you can't just shut down things and think that everything's going to get better. So I think the states that you mentioned, Minnesota and California, are headed in the exact wrong direction, and I think we're going to see it in the next couple of months, and I think it's a mistake.
Alan Cobb, thank you. We're going to take a short break here, but don't go anywhere because our coronavirus conversation continues. We'll check in with our experts from Stormont Vail once again to finish up tonight's conversation.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
They say you get what you pay for, but that's not always true.
My last pair of glasses from the mall cost me $500, but I really love my ones from Success Vision, and they only cost me $200.
Glasses aren't made from some rare earth resource, so they shouldn't cost more than my phone.
Yeah, if you want expensive, well-made frames, go to Success Vision, get them 40% off.
I got to see the eye doctor that's right next door. No wait.
The staff are friendly and know their stuff.
$2 in an hour for less. Come see us today, Success Vision Express.
Welcome back to our coronavirus discussion. This is our final few minutes with you. So I have Tracy O'Rourke and Carol Perry back here with us from Stormont Vail. Now, Ms. Perry, what are some of the residual impacts of the pandemic? Are you noticing more mental health challenges come out of this, both from patients and even doctors and nurses that you work with?
You go. Yes, I will be glad to answer that. Yeah, we absolutely are, and not just from the community, but also from our staff. And so I think that that's what's really prompted from an administrative and organizational perspective recently to really try to have different routes that people can access help from, because you don't know what they're struggling with. And so we want to have several different options for people to turn to, and there's different things that will help different people. So from a community standpoint, we do see a lot of behavioral health needs, and we have a behavioral health team that's in the acute care environment, and then also on the campus off of the main campus is at 6th Street, Vail West, which they do a lot to support the community and the acute care environment, and work together with the medical team to help treat the behavioral health along with the medical issues. So there's many things we're doing, and yes, we are seeing a rise in that need and the stress that people feel at home, and the changes with kids and schools and all the different things, the unknowns and things changing so quickly, that the behavioral health needs are increasing.
Thank you. Ms. O'Rourke, anything you're noticing coming out of the pandemic on this front?
Sure. You know, we've been at this since about March timeframe, and so while early on it was a lot of preparation for what were a lot of unknowns at the time, and started to see the COVID patients coming into the hospital as well as being taken care of in the outpatient. So when you think about the time frame that our staff has been managing through this, you can appreciate how the stress and the strain and the changes have impacted them. And as Carol said earlier, you know, we have a wonderful community that reaches out, that gives a lot of support, that continues to show their appreciation for our team and what they're doing, and there's really nobody on our team that hasn't been impacted by this. What I would say is that if not only for our team and the resources that we provide to them, but also the community resources, is reach out. If you are having challenges, if you do need additional support, it's okay to ask, and that's why healthcare providers are there. That's why we have Family Service and Guidance Center, why we have Vallejo, why we have Stormont Vail, and other resources available in our communities.
Yeah, definitely. And Ms. O'Rourke, let's talk about testing. Can you first tell us the difference between the PCR test and the rapid test? Lots of talk about which one is better, which one is more accurate. What are your thoughts on this? And if people have the option, which one do you think that they should get?
Sure. You know, we have really learned a lot over the course of the pandemic as to what testing is available and what testing has higher sensitivity. I think what it comes down to is you have more sensitivity if you have symptoms versus not having symptoms. The way a specimen is collected versus when we do a nasal swab versus the saliva. There's a lot of things that play into it. So we do the PCR test not only with our in-house testing, but also the labs that we work with for our outpatient testing. But there's a lot of organizations and a lot of systems that are using antigen testing, and this is what people call a rapid test, and so it detects the antibodies. And I think that it's gotten better over the time, and so the important piece is that if you're having symptoms, get tested. We have the call before you go. You can go online through My Chart and you can make an appointment with our testing. We're thrilled to see that Shawnee County has stood up a testing center at Humber Park and has been doing that quite well. So those are the things. If you have symptoms or if you've had an exposure and you want to be tested, you have resources now to do that.
Thank you. Ms. Perry, how are supplies looking? Is having enough tests still an issue? PPE?
So supplies are looking very good at Stormont. We monitor that daily and make sure that we have enough masks and gowns and caps and everything that we need for the staff. Supplies for testing is also monitored daily, and you know, we can monitor that and have a big utilization. That totally depends on the number of patients that that are hitting our doors and that we're seeing come in. So, but we stay a step ahead, and we've done a fabulous job with our supply chain management, looking ahead so that we have plenty to take care of our staff and patients.
Thank you, and I'd like to thank both of you ladies for joining us tonight, our representatives from Stormont Vail, and thank you so much for joining us for this coronavirus special. If you still have a question or something came to mind while watching this, keep sending them in because our conversations do not stop here. Just email coronavirus@ksnt.com. But for now, that's all we have for you right now. Have a good night.